But the challenge we have is mainly reagents for these automated equipment.
A walk into the new refurbished microbiology laboratory at Lira Regional Referral Hospital indicates the Ministry of Health intention of modernizing the health facility.
Expert machine, 16 modules.
Unlike in the past where manual equipments were used, the new development has changed everything for the better.
Where we are here is the automation room, which mainly deals with the chemistry investigations. For example, liver function tests, renal function tests. We also have immunochemistry, which does prostate surface antigen, thyroid function test, and the fertility hormones, and then the complete blood count.
That without a lab, especially the microbiology lab, you cannot really run the infectious disease unit very well. So I'm so delighted that we've come this far. I want to thank IDI so much.
The 500 million investment by the Infectious Disease Institute saw the laboratory renovated and equipped with an aim of averting the economic and health burden caused by microbial resistance.
We can also use this machine to test for cancer of the cervix and then COVID-19. We use this machine.
I want to pledge total support and working together with the Regional Referral Hospital.
While commissioning the laboratory, the Director of Curative Services at the Ministry of Health, Dr Charles Olaro, said the development at the regional referral hospitals will improve healthcare and management as well as reduce unnecessary referrals. Olaro also checked the status of the newly installed CCT scan machine and the space offered by the hospital for the construction of a 3-storied laboratory.
It's estimated that about 1.2 million people die from antimicrobial resistance. Definitely for us in Uganda, we don't have the data that how many people actually are dying. How many people have bought amoxicillin? How many people have bought ampicillin? And then you see that it's not effective. It means actually they have thrown their what? They have thrown their money. This laboratory will be able to get this data. We'll move it also to communities so that we can be able to inform communities and also be able to guide treatment protocol.
Infections that are resistant to antibiotics are not limited to humans, but we find them in animals, we find them in water and environment. But the same bacteria we find in the chicken are also the same bacteria that we find in humans. So if they are exposed to antibiotics and they develop resistance while in chicken, then they can be transmitted to the humans. And that's why in our approach, it is a One Health approach.
This is part of the legal. This came last year.
The hospital director, Dr Nathan Onyachi, says the new lab has helped the facility to treat more effectively than before.
So if a patient comes with urinary tract infection caused by E. coli that we have found in the hospital here, and you give him ampicillin, it will not work. How have we been able to discover that? We have been able to use the new facilities to find that out. So we are now going to be very careful with ampicillin on our patients. Previously, we would just prescribe, and then the patients would keep on swallowing, and then they don't get better and they come back.
Edi Olwa, UBC News.
So we are able now to deal with what they call antimicrobial resistance.